Thanks, Annalisa, for the kind invitation. I am very happy to be here with you. And we start this morning with the use of CEUS in the assessment of a response to local regional therapy. Okay, you know that CEUS has been applied for more than 10 years and plays an important role in the management of ACC in all the phases, because you know that he plays an important role during the ACC surveillance, ACC diagnosis, ACC treatment, and treatment response to ablation treatment. We have a lot of advantages to use ablative therapy to treat ACC, because you know that they do not damage the tissue around the lesion. They do not have the systemic collateral effects of chemotherapy, and they do not have the surgical mortality and morbidity, and they have efficacy. So this is the reason why in the guidelines, these are the more recent guidelines of the European Society of Liver. The ablation therapy plays an important role in the management of ACC. We have a lot of therapies. The more useful and more diffuse in the world are now the application of a source of energy, radio frequency, microwave, and now other new therapies are coming in this therapy, like electroporation. So before the treatment, CEUS plays an important role in the pre-treatment planning, because you can have the real size of the lesion. So you use before the treatment to evaluate the vascularization of the lesion. You can better analyze the margins of the lesion and the relationship between the surrounding structures. And it is important also to compare the vascularization of the lesion before and after the treatment. This is a recent paper concerning the role of contrast ultrasound before the treatment, because they conclude that in case of hypervascular ACC in comparison of hypovascular ACC, we have the indication of a risk factor for local recurrence. So the use of CEUS for this topic is also important to evaluate the efficacy of the treatment. And then another important use of CEUS during the treatment. Sometimes, you know, like in this case, the ACC is not well visualized in B mode. So you can evaluate better the lesion in the arterial phase, like in this case, or in the portal or late phase. And you can use CEUS to better guide the needle in case of not well B-mode visualization of the lesion. And CEUS during treatment. This is a case of microwave ablation of ACC. You can see the needle, and when I put the needle, I saw something here, free fluid here, And during the ablation, I looked at that the liver was becoming bigger, and so I realized that something was wrong. So immediately I inject contrast ultrasound, and you can see that real something was wrong, because blood was well visualized with contrast, and you can see also that bubbles was going in the hematoma. So you can see here blood. Oh my God. Okay, blood. There was an active blood flow. So immediately after less than half an hour, the time to organize, the patient was in the angiographic room, and you can see here the arterial rupture, and this was the result. And the day after, oh my God, it's not okay. No, too much for Carla. Oh my God. Okay. Okay, this is the day after, and you can control the efficacy of the treatment that was done with angiography. You can see the coil heal and the complete absence of bubble now in the hematoma. So you can see how CEUS works during your ablative activity. And this patient was immediately treated without CCT, because it was so clear that an active hemorrhage was present. Then CEUS is useful to evaluate the response to the treatment. You know that recently several studies have proven that CEUS had the same ability to evaluate treatment response in compare with CCT and CMRI. So it can be used as an alternative method for this purpose. You know that the RECIT criteria were modified to include the evaluation not only of the size of the lesion, but the vascularization of the lesion. That is an important evaluation during all kind of treatment, including chemotherapy. So when you have a complete response, like in this case, you can see the disappearance of any intratumoral arterial enhancement in this ACC treated with radiofrequency ablation. And you can see another case in which we can see a viable tumor. You can see here at the border of the lesion the presence of contrast ultrasound in the viable tumor. This is another case in which you can see the complete response to the treatment, and the results are the same that you can obtain with CT scan with comparable result. This is another case months after the treatment, two ACC near one to the other, and with only B-mode evaluation, it's not possible to be sure. We can see a shadow here, but we need to have some information about the vessels. And you can see how CEUS can evaluate the complete response to the treatment. We can use also CEUS to improve your result for treatment. You can see here a huge tumor. And we decided to use a radiofrequency ablation to treat the lesion. So we perform the treatment guided with CEUS to do more insertion to obtain the complete ablation. And you can see at the end the result also evaluated with CT after 1 month. But pay attention to the reactive hyperemia when you evaluate the efficacy of the treatment, that is more intense the day after, but sometimes also after 1 month. Because you know that after the percutaneous therapy, you have a typical hyperemia at the border of the lesion, and sometimes it's not easy to differentiate between hyperemia and viable tumor. So you can have false positive or false negative results. But the CEUS is so important in the follow-up after treatment, because you can evaluate the recurrence of the tumor. We perform in our hospital CEUS every 3-4 months to evaluate the results and the recurrence of the tumor. So you can see here at the border of 2 treated lesions, a portion of tumor that is now with an important enhancement in the arterial phase. So this is a clear recurrence. This is a meta-analysis concerning the use of CEUS in the evaluation of ablation, in particular here radiofrequency ablation. 12 studies were selected with more than 700 patients, and the CEUS obtained a success rate for ACC treated, 91% of success rate evaluated with CEUS. The local tumor recurrence rate was 4%, and local tumor progression rate was 8%. And the tumor was evaluated the day after and 1 month after. This is the same agenda that we use in our institute. So at the end, they suggest that CEUS is similar to other imaging techniques to evaluate the efficacy of the treatment. We have another technique, 3D CEUS, and the technique can have some more advantages in comparison with 2D CEUS. This is our experience. We use 3D CEUS to better evaluate the volume of the lesion. So we can have the evaluation of the real margin, the relationship between other structures. This is an example. We plane the treatment, and so we obtain the real volume of the lesion. We can cut the volume and better evaluate the relationship between other structures, like in this slide. And we can plane exactly the volume that we need to obtain to completely cover the tumor. And so this is a case of two small ACC, one near to the other. And so I know that if I plane this kind of volume, part of the tumor is out of the ablation zone. So I decide to do a bigger ablation volume. So I plane before to obtain a bigger ablation. Eventually, to overcome two areas of ablation. So in this manner, you obtain the complete ablation of both the tumor with a safe margin of a safe margin that is a guarantee to complete response. And then you can evaluate also after the treatment. This is an example that the angle of insertion that you can use, evaluated with a 3D ultrasound. Then the assessment of the response. You can use CEUS, and you can cut the lesion, and you can see that here there is vial tumor. You can at the end obtain the volume of the lesion. So also there are some data about the use of this technique to evaluate the efficacy of ablation, and this is a recent paper, and in comparison with CECT, 3D CEUS has a good sensitivity, specificity, positive predictive value, negative predictive value, and in general an accuracy that is very, very high. And if you look at the comparison between CECT and 3D CEUS, the kappa value is very high, 0.89. So, at the end of my talk, I think really that CEUS in this field to evaluate and to plan the ablative treatment has an important role, because you know that CEUS is important during the surveillance of ACC. But you need the other technique for the panoramic assessment, but then you move to the ablative treatment with the help of CEUS. CEUS is important the day after for complication, but also for a first assessment of the efficacy of the treatment. We perform then CEUS after 1 month, and then every 3 months, 3-4 months for local recurrence. And when there is a new nodule, we repeat CEUS, and then we repeat a CT scan or MRI for a new panoramic assessment. In case of patients in the waiting list for liver transplantation, we perform more CT or MRI, that this is, because this is our protocol. So I think really that CEUS and ACC ablative treatment are together in all phases of the treatment, before, during, and after. Thank you very much.